I mean, that should be malpractice, right? Hey guys, welcome back to the Dr. Cliff AUD vlog. This is vlog number 277, and today I want to share a story with you guys that I think is borderline malpractice. But before I get into it, do me a huge favor, click the like button. It really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. So, I had a patient come in to see me in the clinic just this past week, and it really got me thinking about this whole idea of malpractice when it comes to the world of audiology. So let me just kind of give you some level of understanding of what was going on with this particular patient. So this individual ended up contacting Modern Tinnitus. So Modern Tinnitus is essentially our tinnitus clinic in Scottsdale, Arizona. Dr. Rachel Cook, who you've probably seen on this channel, is the specialist who's out there, or the audiologist who's out there, who's addressing tinnitus. And this individual found us because of some content that we had created around linear, which is bimodal neuromodulation, to help essentially retrain the brain to not be as annoyed by tinnitus. This individual comes in, they go through a bunch of testing, come to find out that he's been searching for a solution for his tinnitus for quite some time. And he had ultimately decided to work with someone on an online basis, basically reaching out to an expert online to address his tinnitus concerns. And the people that he was working with online ended up sending him essentially mail order Phonak hearing aids, and ended up not really getting a whole lot of benefit out of all of this. Now, I'm sure that there was other counseling and stuff like that going on. This individual has a high frequency sensorineural hearing loss and just wasn't getting the benefit that he was hoping for, which is ultimately what led him to reaching out to us at Modern Tinnitus. And so he ended up going through his treatment with Lanier at Modern Tinnitus with Dr. Rachel Cook and Dr. Craig Casper, and this individual is doing markedly better at this point. In fact, he's doing really, really well when it comes to his tinnitus, but there is still the underlying hearing loss that this individual is struggling with. And now you might be thinking to yourself, well, this guy's already got really good hearing aids that are Phonak hearing aids. The problem is that these hearing aids were fit on a remote basis. He never went into an actual clinic to get those hearing aids physically fit to him appropriately and programmed appropriately. Now, the biggest thing in terms of determining success with hearing aids, the biggest thing that will determine how much success you get with hearing aids to both correct for the hearing loss and to suppress your tinnitus as much as humanly possible, is whether or not those hearing aids are programmed correctly to your hearing loss prescription. So everybody who has a hearing loss has a certain prescription for the amount of amplification they need at certain frequency ranges because of their hearing loss. And if you order devices online, you can enter the audiogram of that individual into the programming software for whatever manufacturer you're going to dispense to that individual, but it is impossible to ensure that you're replacing the right amount of amplification or right amount of sound at each frequency range for the individual's hearing loss. And that's because all of these first fit algorithms are based off of averages. And there are some people who have the perfect average ear canal, and if you fit them with a hearing aid, it's going to be perfect every single time. Although I've never actually seen that. I don't know who these average ear canal people are. Never have I ever seen one inside of my clinic, but this is kind of the point, is that you can enter your audiogram data into any hearing aid manufacturer software and get an imperfect programming of that hearing aid. And so this individual was told by this online expert that if he wore these hearing aids and did this tinnitus retraining therapy with masking from the hearing aid, and don't even get me started on masking as a primary tinnitus treatment, but I digress. The issue that this individual had is that he was wearing these devices, these hearing aids, and he had reported that he actually got more benefit from his Apple AirPods Pro devices. Now, if you're unfamiliar with Apple AirPods Pro, I have a ton of review videos about the AirPods Pro and the AirPods Pro 2 being used as hearing aids, but they're over-the-counter devices, basically. They are not prescription hearing aids like a Phonak hearing aid is. So it would make really no sense for someone to be reporting significant benefit from an OTC device compared to a prescription level device. device. And so that just kind of like set off red flags for me. So what I recommended is that this individual fly out to Arizona to see me at my Applied Hearing Solutions clinic, which is different than our Modern Tinnitus clinic. Now, do we address tinnitus concerns inside of Applied Hearing Solutions? Yes, but we only use hearing aids to do that. We do not use any other forms of tinnitus treatment like cognitive behavioral therapy, tinnitus retraining therapy, linear bimodal neuromodulation, or things like that. We primarily replace missing sound due to a hearing loss to see if we can shut down the tinnitus mechanism by just doing that. And if we can't, we have to refer out. But this individual had already gone through specific tinnitus treatment that did not involve hearing aids, and he had achieved a significantly better outcome than what he had been previously doing with these online ordered devices, okay? He comes out to see me in the clinic, and my primary goal is I am going to treat this person's hearing loss to the best of my ability. Now, what do I usually recommend when people come out to my clinic and they have hearing aids already? Well, I recommend that we go through our Applied 360 review process, which is where I actually go and do measurements inside of their ears using all of the different devices that they're currently using. In this individual's case, it was a pair of Phonak hearing aids and a pair of Apple AirPods Pro 2, so I could actually run these measurements inside of his ears to see how close they were meeting his hearing loss prescription. And you know what I found? That's right. I found that he was so far off of his prescription that it was ridiculous. So when you have a high frequency hearing loss, you have to make sure that you give enough amplification in the high frequency ranges, and you have to trap the right amount of amplification inside of a person's ear canal so they can experience the full benefit of doing so. And so this individual was significantly under-amplified across the entire high-frequency range of his hearing loss using both the AirPods Pro 2 and the Phonak hearing aids, and his resonance peak, which is around 2700 hertz, was significantly over-amplified in relation to his hearing loss prescription with his Phonak hearing aids, but not with his Apple AirPods Pro 2. So when this individual tells me that he's doing better with his AirPods Pro 2 than his Phonak hearing aids, it's because his AirPods Pro 2 are actually programmed better than these online purchased and programmed hearing aids that were Phonak devices. So what did I do? Well, I actually switched him out of Phonak because I'm not a huge fan of Phonak for the type of hearing loss that he had. I ended up putting him into a completely different brand that I think is better for a high frequency hearing loss. And you know what I did? I programmed him precisely to his high frequency prescriptive targets. And guess what his response was? Well, his response was, I don't hear the tinnitus at all with these new hearing aids and this new programming. And I'm sitting there going like, well, shoot, too bad you didn't come in 3 years ago instead of going through that whole online debacle trying to use hearing aids improperly programmed to address your tinnitus symptoms. I even went ahead and created a masking program for him. Now, again, I am not a huge fan of masking. I think it is putting a Band-Aid on something that will never actually heal. And I do it, on occasion I do it, because sometimes people just need to have a different program to take the edge off for a few minutes or a few hours, whatever the case may be. But I generally recommend that they end up going back to the regular programming that does not have any masking. And so when I created this masking program for him, and keep in mind, this is an individual who does masking all day long. He sleeps with masking going on inside of his ears using the sleep buds and using the AirPods Pro 2. And then throughout the day, he's doing masking using his Phonak hearing aids and his Apple AirPods Pro 2. He essentially spends no time in actual silence because that's how bad his tinnitus is bothering him. So when I ended up creating this masking program for him, and he sat there and listened to it for a few minutes, he's like, I don't like this. Like, I want to go back to my other program that has no masking but just the proper amount of amplification that this individual needs, because when he's in that program, he does not perceive his tinnitus at all. So this is really what begs the question of, when someone is choosing to treat someone who has a hearing loss and tinnitus online, and they know that they can't follow a best practice protocol when doing so, is that malpractice? Now, I don't actually know the answer to that question. I want you guys to let me know what you think. If a hearing care professional is doing something that they know is not appropriate for the patient, is that malpractice? On the other hand, if they do something that they think is in the best interest of the patient, but research indicates that it's really not in the best interest of the patient, is that malpractice? Basically, is ignorance an excuse when it comes to malpractice? Kind of like if I'm driving on the road and I don't know what the speed limit is, and I'm going 10 miles per hour over the speed limit, and I get pulled over by a police officer, and I tell them, sorry officer, I didn't know what the speed limit was here, so I don't think that I should get a ticket. You know what that police officer is going to tell me? Ignorance is not an excuse. I kind of think of this the same way when it comes to audiologic care, both from a tinnitus perspective and from a hearing loss perspective. There are certain things that pretty much every hearing care professional knows that they should be doing for their patients in order to achieve an optimal treatment outcome. And that was not done in this particular instance. In fact, this is being done over and over and over again by any hearing care professional who is dispensing hearing aids online for the purpose of treating hearing loss and tinnitus. But again, you tell me, am I blowing this way out of proportion? I mean, maybe this individual did get some level of benefit from this online care that he had been going through for a couple of years, despite the fact that he really didn't report any significant benefit going through this online model. But I don't know, maybe I'm completely out of line here. I want you guys to let me know what you think. Do you think that it was malpractice by this hearing care professional by dispensing these devices online to a patient without giving them any benefit? Or is it that person is just trying to do the best with what they have and was limited not by their capabilities, but by the patient's willingness to actually go and travel and get professional care in a clinic? Let me know down in the comment section.